Wonderful. So I'm going to go through this pretty quick, especially this first part, because we're going to do a little bit of history, but around COVID, but then we're going to get into where we are today. But I thought it was helpful to just kind of talk about how we got where we're at. I don't want to spend a lot of time on history because most of it doesn't matter. It's in the past and it can't be changed. But there are some things I think we can learn about how things progress. So I'll go through that first. My interest in documenting this started actually on March 8th when I was following the information about the world crisis. And I wrote a sticky note to myself that said, what's wrong with Italy? At that time, Italy was the world's, in the whole world was having the highest number of cases and deaths. And it seemed as though it was nonstop. And I had this idea that if the United States would pay attention to what Italy was doing, since they were about a month ahead of us, our really good science and medical community would be able to learn from the mistakes Italy made and we wouldn't have to repeat them. Of course, I didn't realize at that time how badly the federal government could screw things up. But this is the very first set of data that I collected the first time I sent out my newsletter on March 28th. Italy is the dark green line over here on the left, which are the number of cases, and over on the right are the daily number of deaths. And you can see that already by the middle of March, the United States was beginning to eclipse Italy's numbers. We hadn't caught up to them in deaths yet. So at that point, they were still about a month ahead of us. And like I said, I thought that would give us time to catch up and do a better job. By the time we got to the middle of April, the United States had really taken over the numbers for the world. So the blue lines on this left graph are the number of new cases each day. Italy has now dropped down to these little red marks at the bottom. I added Spain at that time because Spain was also having a big outbreak in Europe. But you can see that by middle of April, the United States had already started to really outnumber the rest of the world, both in cases and in deaths. So if you take a look over here, the yellow line, which is the moving average, shows that by that time in April, we were already in pretty bad trouble. What happened was that first surge, which is the one that mostly affected New England, that's New York and Massachusetts and New Hampshire and New Jersey, that first surge started to come under control until we got to Labor Day last year. And from Labor Day to the 4th of July through summer visits, we then had gotten to this second surge, which peaked in late July, which we thought was the worst possible number that we could ever possibly see because it was such a disaster compared to where we had been in the first surge. And the deaths were kind of following that same pattern, which was that there was a delay between when we saw cases and then the deaths that resulted. But that same thing was occurring where the United States, compared to Italy, was still way far ahead of all the numbers in the rest of the world. And then we got to this week. So this is where we now are. That huge surge we saw in July is actually here on July 25th when we hit the peak number of cases. We went through a very optimistic period into September, which things started to look pretty good. But then we hit Labor Day, Halloween, Thanksgiving, Christmas, and New Year's, and suddenly had completely overwhelmed the numbers that we thought were the worst ever and hit our peak number of cases on January 8th when we had 262,000 cases each day. Since then, we've been finally able to bring this under control. And what we're looking at right now is about 24,000 cases a day, which is still higher than we saw at the beginning of the summer peak. But as we continue to improve, we hope to see these numbers finally come down to the earliest period. And that also reflects in the deaths. So this is the way the deaths worked out. The first surge in New England, the summer surge, and then the holiday surge, bringing us back to where we're at right now, which is about 600 deaths per day across the United States. So that's a real quick history. Like I said, I don't want to go into that too deeply. We'll have a Q&A session in just a moment if there's questions about that. One of the things about the winter surge is that we had excess deaths. If we could have listened to the experts and stayed put for a little while longer, which would have meant spending waiting 6 more months to make those travels across the United States to visit family and friends, we could have held the number of deaths to the horizontal line, which was where we were in October, which would have been about 700 deaths per day. But what happened was, because we had so much travel, there were 80 million people in the United States that traveled more than 50 miles by either airplane or car during that period. There were 7 states that never had any mitigation rules at all. So those states never did anything to try to protect their populace. But by the winter surge, we had about 20 or 25 states that had very much relaxed all of the regulations they had to protect the population. We then had a lot of activity move indoors, and virus is much more contagious indoors than outdoors. Then there were 4 variants that appeared, and all of those variants were between 50 or 70% more infectious than the virus that we had worked with originally. And we ended up, by the end of April, with 610,000 Americans that had died. Now, if we calculate the excess deaths, it would be the number of people in this peak that died beyond what could have happened if we could have held where we had been. And that comes out to be about 226,000 additional deaths. So about 38% of the loss that we had was avoidable if we could have just waited 6 more months before we let things let loose. Unfortunately, that didn't happen, which leaves us where we are today. This is how it looks against the world. The blue line is the world cases, and the orange lines are the United States cases. Back in January, the United States contributed 35% of all of the cases in the world. And when we're talking about the world, we're talking about 200 different nations that are tracked by my data source, which is worldometers.org. Right now, because of our success with vaccinations, we now have dropped to the point where we are only contributing 4% of the cases of the world. And we have especially large outbreaks in India and Brazil right now. So that is a big difference, is that part of the world is increasing. We are now finally being able to bring things under control, which now is looking much more promising. Now, I only do this graph every 28 days. So this takes us to about the end of, or early part of May. In about 2 more weeks, I will then add my next point, which is 28 days later. So the world numbers are actually coming down a little bit, but we're still seeing a very large number of cases across the world. So we'll just take a moment here. Ron, if you could just let people unmute themselves and just see if anybody has any questions about the historic numbers that we just took a look at. Okay, anybody have questions? Nope.
Greggy, this is Cynthia.
Yes.
I am wondering about the summer and the coming interest in people doing more international travel. And I know that here in the United States, we have or in most of the United States, we have a fairly decent vaccination success. But what happens with the increase in international travel during the summer and so much of the world's population not being vaccinated?
So one of the things that's really good, and we'll take a look at this in a little more depth later on, is the vaccines are so effective, and including the vaccines that the United States have. The 3 vaccines that we have are not only effective against the original virus, but also against the variants. So if a person is vaccinated, and even if they're going into one of these hot zones, they should be in good shape. It's still feasible that some variant could break out that is going to circumvent the immunity that our vaccines have, but that hasn't happened yet. And so at this point, vaccinated people traveling to other parts of the world, if they allow it, I mean, there's a lot of countries that don't allow any travel at all, should be safe. However, the people that are in those different areas, we'll take a look in a minute at the world map and see where the hot spots are, but those areas are still in really serious conditions. Okay, any other quick questions? We'll just move on, and if you have other questions, you can either put them in the chat window or we can grab those later. So we're going to take a look at safety. How do you protect yourself from becoming infected? There's really 5 different things, but the 3 things represented by this safety triangle are the things that you can do separate from a mask or separate from vaccinations. And so these are the things that we can do to protect ourselves. And the three parts are distance, time, and ventilation. The thing about distance is, and this has been true through the whole pandemic, if we could keep the amount of space between ourselves and other people to be greater than 6 feet, that enhances our safety by at least 80%. Uh, Time is how long are you near somebody who might be infectious? And generally speaking, um, you normally have to be in an area of a large amount of virus for more than 15 minutes before you've inhaled enough of it to become infected. So the amount of time, if you can make that smaller than 15 minutes, it's going to improve your safety. And the smallest amount of time, like if you're waiting to cross the street at a traffic light, for example, of maybe 90 seconds or 2 minutes, puts you in a very safe position. And the third thing that has a huge difference is fresh air. And of course, with this nasty wind that we've been seeing for the last 2 months here in San Francisco, if you're outdoors, the chances of any virus being available at a moment that's concentrated enough to cause you problems are practically at zero. So even if you don't wear a mask, and even if you're not vaccinated, controlling these three factors are the critical things as far as safety. Now, when we're talking about masks, there's a big difference as far as how effective they are. This chart shows you that if you are wearing an N95 mask, you only have about a 5% risk because 95% of the particles are blocked. If you're wearing a surgical mask, a paper surgical mask, it's pretty good, but not quite as good as the N95s. So you're probably at about 8% of risk. If you have a two-layered cloth mask, there you have a little more risk. And so now you're between 5 and 20% of risk, but you're still 80% protected, which is still pretty good. The valved N95 mask is a little tricky because as the wearer, you're still at 95% protection. But as far as exhaling, your breath is going out through the valve. So you're actually putting other people at risk. So that's why that is not considered as good as the fitted 95 mask. But if you're the person wearing the mask, you're still very well protected. Now we get down here into the knitted masks, and now you're getting into a much more risky situation because the size of the openings in the material are much larger. So there, you're probably only at about 60% protection or giving yourself a 40% risk. If you're wearing a bandana, which is a handkerchief over your nose, that is even less protection. So you probably have about 20% protection on a bad day, and that puts you at 80% risk. If you don't have any risk mask at all, you might wonder why it's not just 100%. And the reason is that when you're not wearing a mask, the chances of you touching your face after you might have become contaminated actually increases the risk. So the mask itself would have prevented you from touching your face. So you actually might be 110% risk or a little bit more than just breathing normal air. And then finally, if you wear what's called a neck gaiter, which is a cloth thing that you can pull up and pull down over your face, that one is actually the riskiest of all. And the reason is that the cloth that is protecting you when it's up over your face is also collecting virus. And then when you pull it down and push it back up, you actually are taking some of that virus that the cloth has collected and putting it back into your nose. So you're actually increasing your risk if you're in an area that has a high level of virus. Now we're going to take these numbers in just a second and kind of overlay them with each other to see how things add together. The way that works is we still have those three critical items of the triangle of safety, but now you have the compounding effect of each of the different mitigations. Now, when you're figuring protection multiplies. So if you start with 70% protection from a vaccine, which would be a vaccine that didn't take very well, and you add that to 3 feet of distance, which is half the distance that you want, you still have the multiplication of 70% and 40%. And by the way you have to calculate this is you have to calculate the risk, not the safety. So this would be a 30% and a 60% calculation, but they multiply. So this 70% protection becomes 82% even with short distance. Even if you can't keep the amount of time, you still are getting some protection, which again takes you to 89%. If the ventilation, you're in a room that has very poor ventilation, or possibly the worst ventilation is where you have a fan that is simply moving air around but not going through a filter, That's only 40% effective, but it adds to the other layers of protection. And finally, if you have one of those really poor masks that I just showed you, a bandana, it's only going to give you 20% protection, but adding to or multiplying to the other protections, even then, you have protected yourself to a 94% or 95% protection. So even in kind of these worst case levels, you're still in pretty good shape if you have combined several layers of protection. If you're lucky and can use the best layers, you can use a vaccine that's 95% effective. You are at least 6 feet away from somebody with a virus. You are less than 15 minutes in proximity to them. You're outdoors, maybe on a windy day, and you have an N95 mask. You can see how the protection easily gets to well over 99% and is so close to 100% protection that the decimal points run off the end. So that's just one of the things to keep in mind is everything adds to each other. And even if you have some risk from one area, if you are also taking care of these other areas, you still can be in a pretty good position. The thing that is most effective now is that we have the vaccines that we didn't have before December, and that is one of the big game changers. So, okay, what is he? I can't read it. Oh, I know, but okay. Yes, somebody, so Patricia said that the numbers are undercounted. Yes, that's true. We have an undercount. We don't know by exactly how much, but yes, you're probably right. It's probably closer to 900,000. And we'll get into that a little more details when we get into the questions and answers. So one of the big questions is it safe to fly? Well, first of all, the thing to understand about airplanes is that 85% of the air in an airplane comes from outside. So you already are starting with that really high level of ventilation where almost all of the air is coming in from outside. And the 15% of the air that is being recirculated is passing through HEPA filters. So even that air is much safer than you'll find in most situations. Masking is still required of all passengers except when you're eating. So that now adds to the protection of that amount of fresh air that you have. Currently, the positivity rate in the United States is only 2.6%. We'll take a look at positivity in just a moment. But back in January, positivity in some parts of the country were higher than 35%. So that is also reducing your risk because very few people on the airplane are going to be infectious. And finally, the riskiest place when you're flying is not the airplane, but the terminal. So be sure to wear your mask when you're in the terminal and maintain distance and so on as much as possible so that part of it doesn't become the weak point as far as your protection. So the answer is it safe to fly? Yes, it always has been inside of the airplane. The terminal itself has always been more risky, but if you're cautious, you should be okay as far as flying. One of the things I want to also explain is what is the impact between life and death? And what you're going to see in almost all of the articles is the percentage of people or the number of people who have passed away and the percentage of people who have been tested positive. So I call that the didn't die yet combination. So in this big blue part of the zone, we know that people have been tested positive, but they didn't die, but maybe they're in the hospital or maybe they're about to get very sick. So we don't know how that one's going to turn out. This is the current CFR. CFR is the case fatality ratio or the case fatality rate, and it is the mortality percentage and is calculated simply by dividing the number of deaths by the number of confirmed cases. And currently the United States is 1.78%, and we've been at that level for about 2 months now. What really happens is this. I did some research back in March to understand what happens inside of the big blue zone of the graph. And here's what is happening. Of those 98%, 40% of those people were asymptomatic. That means they did have the virus. They had no symptoms at all or such mild symptoms that they didn't even notice them. And so that is a big chunk of the people who had been infected. 51% of the people had mild symptoms, and mild symptoms can range anything from just a mild symptom like a small fever or a mild cough, all the way up to I'm just about to dial 911 for an ambulance because I'm really feeling crappy. But of this percentage, these people didn't have to go to the hospital. So what you end up here is about 90% of the people did not end up hospitalized. And then what happened was about 6% of the people ended up in the hospital but didn't have to go to the ICU. 1.2% of the people ended up in the ICU. And then our 1.78%, which is the same number we have over here on the left, ended up passing away. But that, I think, helps to understand in the past, what was really happening was that people were experiencing different levels of illness depending on their immune system and how well they were able to fight off the disease. Now let's add vaccinations to that. Vaccinations do not prevent becoming infected, they reduce the risk of severe illness or death. And that's where these articles you're reading about breakout cases are pretty much overhyped as far as seriousness, because the thing the vaccination is intending to do is two things. One is keep you out of the hospital, and the other is keep you from dying. And all three of the vaccinations that the United States have right now are close to 100% effectiveness as far as meeting those two requirements. But what they do is this: instead of 40% of the people being asymptomatic, we now have doubled that. So at least 80% of the people, if they happen to become infected because they're near somebody that is shedding virus, are going to not notice it at all, because the vaccine is going to fight off the virus so quickly that you don't even notice any symptoms. 18% of the people are going to have mild symptoms, and only a tiny percent, and I've actually exaggerated these a little bit so at least the numbers show on the graph, but a very tiny percent of the people end up hospitalized. Even fewer of those end up in the ICU. And right now we are looking at something like 1 in a million people end up dying if they're vaccinated and don't end up with some other condition that causes death that really isn't directly related to COVID. So that's the key thing about vaccination, is it may not prevent 100% from becoming infectious. However, it is doing a really good job of preventing serious illness and death. And even the people who are in, like the 8 players from the New York baseball team, the 8 people who tested positive, none of them experienced any symptoms. So even though technically that was considered a breakthrough, they really didn't have anything that was serious. And the thing that has recently been discovered is that the vaccines are so quick in response to being able to knock down the virus that you don't ever get to that point of actually becoming contagious to other people. It normally takes 3 to 5 days for your body to produce enough virus before you begin shedding virus particles. And the vaccines are so effective that before that happens, they already have taken control and killed all of the virus that's working with you. So that's just one thing to understand about how vaccines work. They work really, really well. Now, not all vaccines, other parts of the world have vaccines that are not doing as well. And so some parts of the world are at much higher risk because they don't have the highly effective vaccines that the United States has. The safety of vaccines is another thing that people worry about. It seems as though the vaccines were produced very quickly, but what actually happened is the design of these vaccines began 6 years before the COVID virus appeared. And you might wonder, well, how did we know 6 years in advance that this was needed? And it was because the previous 2 outbreaks of really major illness, which was SARS in 2003 and MERS in 2012, both of those were coronaviruses. And so the medical community said, you know, it's highly likely that if we're going to have another outbreak, it's probably going to be another coronavirus. So let's start working on a vaccine now that can be quickly adapted to whatever this new version of the coronavirus is. So the medical community, the pharmaceutical companies had actually begun work on this 6 years ago. So that is part of the reason that we were able to get a vaccine so quickly. The thing that they had to do is, once they had gotten the genetic sequence of the new virus is this thing, SARS-CoV-2, which is SARS-CoV version 2. All they had to do is plug that genetic code into the design that they had already been working on, and it was then tailored specifically to the COVID-19. Then we went through all of the normal tests for safety and efficacy that all vaccines have to go through. which is phase 1, 2, and 3. Phase 1 is testing for safety in animals. Phase 2 is testing for safety in a few human beings. Phase 3 is huge numbers of people that are being tested both for safety and efficacy. So all of the vaccines went through those tests completely, with more than 30,000 volunteers for each of the vaccines going through this long testing process before they were finally approved for use. So the safety was not really shortcut. It's just that we had a really good head start that let us turn that around quickly. And then just to understand, in general, 40% is considered a really good percentage of protection for most vaccines. We are at 80 to 95% efficacy. And so we are well beyond what was expected as far as protection, which puts us in this good spot that we are in today. Any quick questions about vaccines before I go on?
Yes, there's one here from Carey.
Okay, we got one in the chat room. Ron tells me. Let me take a look at this one. Right, so 80% of the vaccinated people could become infected and not know it. That's right, because they're asymptomatic. That is, yeah, we talked about that a moment ago. But what that really means is that those people are certainly not going to get ill to the point of needing hospitalizations and not in the risk of dying. However, yes, it's possible that they could have asymptomatic symptoms. Both the United States and California have decided to stop tracking the asymptomatic breakthroughs because they are so small in number, but also because they are so small in importance. So while that is feasibly correct, it's not something of concern because the asymptomatic people are not likely to get sick, and they're almost impossible for them to spread the disease to other people. Hopefully that took care of that question. We'll go on. This is where we're looking in the United States for vaccination right now. The darker reds are the areas that have the highest rates of vaccination. So all across the West Coast, we're doing really well. The areas that are really poor are part of the Rocky Mountain, that's Idaho and Wyoming, and a lot of the Deep South, where there's very low vaccination rates. But the rest of the United States are either in the really good categories of the dark red or the pretty good areas of the lighter red. So vaccination-wide nationally is looking pretty good, unless you're going down into these southern states where Mississippi is the lowest percentage in the nation right now. They've only vaccinated somewhere around 30% of their population. California is looking at 60%. So that's where we are right now in vaccinations. This is the delivery of the vaccinations. We have the 3 vendors. The dark lines are when each of the vendors are hitting their promised delivery rates. So we saw in just the first part of June, both Moderna and Pfizer added a lot more capacity. Johnson & Johnson is supposed to have their maximum capacity available in the later part of June. And by the end of July or early August, we are going to definitely be in an excess with the ability to completely cover 400 million people. The United States only has 330 million people. So we will have a surplus of vaccine, which the United States has promised to share with other nations that are not as fortunate as we are. So that is where we're looking right now in vaccination capacity. How does herd immunity work? Herd immunity says that we need better than 80% of the population with immunity in order for the virus to begin to just die out. Now, where we are right now in the United States is we have about half of the population vaccinated. So out of the 322 million people, 167 million have already received at least 1 dose of vaccine, and a single dose of the 2-dose series already gives you 80% efficacy, and then the second dose raises that to 95. But the other part that you have to consider is the number of people who had the disease at one time and then recovered from it on their own. So these are what we call self-acquired immunity. And there have been about 85 million Americans that have self-acquired immunity. And then there's this big overlap in the middle where a person who did recover is also vaccinated. So what we end up when we're trying to calculate where we are in our immunity is we have to ignore this overlap area and just consider the number of people who have self-immunity. but have not yet been vaccinated. So we put that at about 40% of the total in our calculation. So this is where we are right now as far as the US population. The formula we use for figuring this out is we take the percentage that are vaccinated, we take 2.5 times the number of cases. 2.5 times is the estimate that we get from George Rutherford, who is a professor at UCSF, who estimates that of the confirmed cases in the United States, between 2 and 2.5 times as many people were infected but never got tested. So we apply that multiplier. We subtract the number of people who died and then take that times 40%. So that 40% now is this yellow area over here. And then we divide that by the total population. So just real quick, how do we get that percentage? That's what that looks like. And right now, the United States is standing at about 60% of the American population has immunity from one source or the other. If we want to take a look at how the US compares locally, so we're at 60% for the nation. California is at about 66% total immunity. Bay Area is at about 70%. And San Francisco is at least at 82%. So San Francisco has reached that level that experts consider to be herd immunity, but because herd immunity really talks about the whole country, they now have adopted a new term, which is called community immunity. But right now, San Francisco is at that point where the number of infectious people are so small that the virus itself is very, very low risk. And we're continuing to do additional vaccinations. So we will continue to take that number to even higher levels. But right now, San Francisco has the best numbers in the whole country, and California right now is the best in the United States as far as states. When you look at both infections and illnesses, deaths rather, over the last month. So that's where we stand in relationship to the United States. Let's take a look at how, I'm just going to pause here for a moment just to explain that this is now just the immunity part of it. Now I'm going to take a look at how the level of positivity affects. Positivity is the measure that says when we test a lot of people, how many people are positive, how many people already have immunity because they have recovered, and how many people out of a random sampling of people have tested positive. Back in early part of the year, California was at about 20% positivity. As I mentioned, some states were as high as 35% positivity. So if we took this room full of 100 people, and the red dots represent the people who are infectious, and the green dots represent the people who have already recovered from the disease, we end up with this population in the room. And we can see that the number of infectious people compared to the people that are at risk, which are the white dots, gives a very high chance that you are going to have a super spreader event. Now, these 100 people might be at a theater, they might be at a political rally, they might be at some other thing where you have a large number of people. And for this particular example, all of these people are maskless. So we have all of these unmasked people in this room, but you can see that the number of infectious people compared to the number of people at risk easily can add another 20 or so people. Now, one thing to keep in mind is that these people who just got infected at this event cannot infect other people, because it takes 2 to 5 days before a newly infected person becomes infectious themselves. So we have a super spreader event, but it's not that these people who just got infected at this moment now can infect the other people. There's that delay where your body has to build up enough ability to replicate the virus to make it at risk. What happens when we take the positivity from 20% down to 1%, which is where we are right now in California? Now the room looks like this. We still have the 20% of the people in the room who have their own self-immunity. We only have one infectious person in the room. And as long as this person is sitting in one spot and not sneezing or yelling or singing, they're only going to be affecting people within about a 6-foot radius. And now you see that out of this room of 100 people, we only have a few at risk, maybe 7 or 8 people that might be at risk. And so now we have, by bringing the positivity down, also increased the safety as far as the population. And now if we add one more layer, which is Now we have 40% of the room that has been vaccinated. We still have the 20% of the people who have self-immunity. We still have the 1% positivity. And you can see now what's happened is all of these people who have either vaccine or self-immunity are protecting the few people within the radius from the infectious person, so that the chances of 1 or 2 cases might be the worst case, but it might end up being no infections at all, because not every single person is going to be infected within just one event. So that's what happens when you combine the vaccination and the positivity. And both of those are numbers that right now, especially in San Francisco, are just an excellent spot. Our current state, as far as the world, these are where the hotspots are. So the dark areas of the world are the ones that are having the huge outbreak. South America, almost the entire South American continent is in a world of hurt. Argentina, Uruguay, and Colombia are in the worst positions. Brazil is still in pretty bad shape. Brazil, however, has a higher population than these other areas. So when you look at the problems in South America, you pretty much have the entire South American continent that's at risk. In Europe, Sweden and France are the 2 nations right now that have higher risk. If you go to the Far East, Mongolia, India, Oman, in Nepal and Malaysia are the areas that are really having severe outbreaks right now. So the question earlier about world travel, you really want to take a look at the map and see what is the condition of the areas you want to visit. There's a small area in South Africa that is outbreak, Botswana. The rest of Africa we can't depend on, because the amount of testing and the infrastructure to be able to report risk is really not very good. So we don't know really about the rest of Africa, but we do know for the rest, most of the world, that these are where the real hotspots are right now. Dr. Monica Gandhi, who is with UCSF, she has been a leading expert on contagious diseases at Zuckerberg, has said, no one in the world is safe until the world is vaccinated. So one of the things that we have to continue to really help the world control the outbreak of COVID, both for safety of the people, but also to prevent the new variants from cropping up. Here's San Francisco. We're at 70% of the population has received at least 1 dose. 66% of the city has been fully vaccinated. Here is our snapshot. We now are down to 14 cases per day as far as the average. We have had 0 deaths for 3 weeks in a row. We only have 11 people in all of the hospitals in San Francisco. We are still testing at a pretty good rate, about 3,600 tests per day, which is still enough so that we can see that our positivity is looking good. Our positivity is almost 0.5%, so it's about half of what we have in the examples we talked about earlier. And vaccination numbers are dropping off, but that's because we are reaching to that point where the number of unvaccinated people are harder to reach. And so we have plenty of vaccine available, but the daily number of vaccinations are down somewhat. This is our positivity curve back at the beginning. We were over, this is San Francisco again, 13% when we were back at the beginning of the year. We were over 5%. Now we're at about 0.5%. So the positivity continues to look really good. And this is our hospitalization curve. This is back in January. Now we're down to 12 cases total in the hospitals in San Francisco. So what's going to happen on June 15th? Well, the state has said they're going to remove all of the mandates. That means that all of the state requirements are now removed. Cities and counties can still have their own local requirements. We'll have to wait and see how that works out in the next 2 weeks. And we do have 3 counties in the northern part of California that are still having local outbreaks. Chaska, Siskiyou, and Del Norte all are having outbreaks. We'll have to see whether the state is going to also let them just remove all of the mandates, or whether there might be an exception because they're still having outbreaks. Masking will become voluntary, both indoors and outdoors. However, there are still rules that apply. The federal rule still applies to public transportation, which includes Muni and trains and airplanes. So there still will be a requirement for masking in public transportation. And businesses might require masking or proof of vaccination. That's up to each business. And we might see, for example, at nightclubs or maybe particularly in areas where you have a large number of people at work, there still might be a requirement for masking. The capacities will return to normal, so all of the capacity limits in stores and in bars and in restaurants will return to normal, as well as any regulation of business hours. So on June 15th, 2 weeks from now, California is just going to try to return to normal as much as possible. Just a few other notes before I end. First of all, booster shots, we still don't know if they are needed. Right now, it's looking like they probably won't be. Most of the testing that we're seeing right now, it's been 1 year since Pfizer began their testing, and all of the people who are in that first group are still showing really high levels of immunity, which means that the immunity from the vaccines are at least a year. And so far, there's no reason to think that those are going to wane. All current variants are handled by the 3 vaccines that the United States uses. So unless a new really nasty version breaks out, we should be okay. And one thing to keep in mind, especially if you're reading news articles, immunity is more than antibodies. So many news articles talk about the fact that antibodies drop off after a period of time. But the real point is that our immunity system depends on B cells, which are called memory cells. And one of the things they found by testing the blood of people who survived the 1918 Spanish flu is those people still have immunity to the Spanish flu 100 years later. And then the B cells in turn trigger T cells, which are called the killer cells. And those are the ones that move right to your nose as soon as the virus comes into your body and kills the virus before it ever has a chance to set up shop inside the body. So immunity is more than just antibodies. And so far, what we're seeing in B cells and T cells looks really, really good. And the thing to remember is you can wear a mask as long as you want to. Even though masking is not required, you're certainly welcome to wear it. Now, there will be mask shaming from both directions. You will find that if you're wearing a mask, there will be people that will be shaming you because they're not needed, but you're also going to see the opposite direction, that if you're not wearing a mask, somebody's going to come up to you and accuse you of trying to kill somebody. But it's really a balance of putting yourself in the area where you find most comfortable and then make your own decision and try to tune out all of the noise. One of the things that was mentioned 2 weeks ago in the UCF Grand Rounds is that in many parts of Asia, masks are worn most of the time because it's considered rude if you infect somebody else. So that type of approach could be something that more people in the United States use, which is even though there might be a really safe condition, they just might feel more comfortable wearing masks. And if they wear masks forever, that's okay, as long as we don't try to shame them too much. Tomorrow.